everyone, welcome back to our concussion talk. Today we're going to focus on post-concussion dizziness, more focusing on the approach instead of the physical examination. Now for dizziness, we always want to have a wide differential diagnosis. Think about, is that vertigo related, disequilibrium related, is that cardiac causes, pre-syncope versus non-specific lightheadedness. If this is vertigo, is there any hearing loss? If there's hearing loss, then you're thinking about another type of differential diagnosis. If there's no hearing loss and episodic vertigo, the most common post-trauma is benign paroxysmal positional vertigo, which is something that you can diagnose at bedside by doing Dix-Hallpike. Now, I want to bring it to your attention is this something called acute vestibular syndrome. It's a clinical condition that also presents with dizziness. Sometimes come with nausea, vomiting, unsteady gait, nystagmus, intolerance to any head movements. So you can see that this clinical syndrome is very similar to some of your concussion patients, and they have similar presentation. Sometimes the symptoms can persist for days for acute vestibular syndrome. Interestingly, there's also something called isolated acute vestibular syndrome, which could occur in the absence of any neurological signs, such as hemiparesis, hemisensory loss, or gait palsy. Now, the most common causes for this acute vestibular syndrome are vestibular neuritis and ischemic stroke. Unfortunately, ischemic stroke and peripheral vestibular disorders are very similar. Potentially could have no focal neurological signs in more than half of people presenting with acute vestibular syndrome due to stroke. Okay, so this is a CMA Jade publication back in 2011 about a systematic review. In this study, it actually highlighted some of the central causes for acute vestibular syndrome. It could be ischemic stroke, hemorrhagic stroke, or multiple sclerosis. These are the differential that we want you guys to pay attention to and rule things in and rule things out. Of course, there are always some other causes, such as endocrine abnormalities, infection. What to highlight here is the ICA versus PICA stroke. PICA come with no hearing loss, also present with vertigo, versus ICA presents with vertigo and unilateral ipsilateral deafness. Please check out our concussion study guide for more details about dizziness. See you soon!